Hey there, I'm Professor McBride, labor nurse, OB instructor, and your guide to everything OB. Let's get to it. Let's talk about APGAR Score. An APGAR score is a scoring tool that we use for all babies to assess well-being when they're born. Every baby is assessed an APGAR score at 1 minute and at 5 minutes of life. If the APGAR score is less than 7, we will continue to reassess every 5 minutes for up to 20 minutes. And then during that time, we are doing things to improve the score by stimulating the baby and maybe other interventions if needed. So the APGAR scoring tool is a tool that has 5 categories: activity, pulse, grimace, appearance, and respiration. Activity is where we assess muscle tone and movement. So if the baby is limp, floppy, has no muscle tone, they get 0 points. If the limbs are flexed, but we're not really having much movement yet, they get 1 point. And if there's active, spontaneous movements, they get 2 points. For pulse, we are assessing the heart rate. A normal newborn's heart rate is between 110 and 160. For this purpose, we're going to say above and below 100. So if the baby does not have a heartbeat, they get 0 points. If the baby's heartbeat is less than 100 beats per minute, they get 1 point. And then if the baby's heartbeat is greater than 100 beats per minute, they get 2 points. Grimace assesses response to stimulation. So if you have no response to stimulation, your baby is limp and floppy, 0 points. If you get some response, so you can see it in their facial expression, they're making an annoying face, but they're not really crying or trying to get away or move away from what's annoying them, 1 point. And then if you have a strong response like pulling away, crying, then you get 2 points. Appearance looks at the newborn's skin color. So if the baby is blue or pale all over, they get 0 points. And this might happen in that first minute, in that 1 minute APGAR. When babies come out, they don't come out pink. So once fetal circulation shifts to using lungs for oxygenation and the baby's breathing and crying, then the baby starts to become pinker. So at 1 minute of life, they might still be blue or pale. And if they are, they get 0 points. Typically, by 5 minutes of life, this is what you'll see. A baby that has a pink body, but the extremities are still bluish or discolored. And this is called acrocyanosis. This is considered a normal finding for babies in the first 24 hours of life, but they're still going to lose a point for it in the APGAR score. And then if your baby is completely pink head to toe, they get 2 points. For respiration, we're looking at respiratory effort. So if the baby's not breathing, they don't get any points. If the baby is starting to have some slow or irregular breathing, they get 1 point. And then if the baby is crying, they get 2 points. So for crying, we want a nice, strong cry. And we use terms like vigorous and lusty to define the type of cry we would like to see. These are going to be the cries that really clear their airway, get everything moving. And so that's going to be ideal as a vigorous cry. So when we assess the APGAR score, we're thinking about with activity, do they have good muscle tone? Are they moving their extremities? Are they floppy? The pulse, is the heart rate above or below 100? Grimace, how are they responding to stimulation? If the baby's floppy under activity, they're probably also losing points in grimace. Appearance, what's the color look like? Are they blue? Do they have acrocyanosis? Are they pink? And then respiratory effort. Are they crying? Are they gasping? Are they apneic? And remember, we want that strong, vigorous, lusty cry. Remember that if the score is less than 7 total, then we're going to continue to reassess every 5 minutes for up to 20 minutes. So let's determine an APGAR score. If we look at this baby, for activity, do we have flexed arms and legs? Do we think this baby's moving around and moving their limbs? I think so. So 2 points. For pulse, in order to truly assess the pulse, we would need to put the stethoscope on and listen and count. You can also palpate a pulse on a newborn at the stump or the base of the umbilical cord. You can feel it there. For our purposes, based on the fact that this baby is pink and screaming, the pulse is probably over 100. So we'll go ahead and give them 2 points. For Grimace, we're looking at how this baby is responding to stimulation. Are they floppy? Are they giving a minimal response? Or are they really responding? And the fact that this baby is crying is a good indication that this baby is responding well. So we'll give them 2 points for Grimace. For appearance, this baby is nice and pink on the trunk and on the face and what we can see of the legs, but those hands are not pink. So we're not going to lose all of our points because we are pink on the body, but we can't have all the points because this baby has acrocyanosis. So for appearance, this baby will get 1 point. For respiration and respiratory effort, we have a baby who's crying. So we have that nice strong cry, so 2 points. So we're going to add these together and come up with an APGAR score of 9. Let's look at another baby. This baby is blue and floppy and not doing well. So when we look at activity, are the arms and legs flexed? They're not. This baby's actually really floppy and has no muscle tone. So for activity, they're going to get 0 points. For pulse, we would listen with our stethoscope. And for this baby, my guess is that based on the fact that the color is what it is and the tone is what it is, this baby's pulse is probably under 100. It might not be, but since we can't listen, we're going to say it's probably under 100. We'll give 1 point. For Grimace, we have a floppy baby. This baby's not responding to stimulation, so there's no points for Grimace. For appearance, we have a pale blue baby that is not pink at all, so there's 0 points for appearance. For respiratory effort, I'm not sure if this baby is making any efforts to breathe, but if they are, it's minimal. So probably also 0 points for respiration. So the APGAR score for this baby is a 1. This baby needs help, needs interventions. We're not going to wait for 5 minutes to reassess the APGAR score and do nothing. This baby will start out stimulating this baby. A lot of things will fix with breathing. If they get this baby breathing and oxygenating, the color will improve, the muscle tone will improve, the pulse will improve. And so this would be someone that if this was your baby that you were taking care of as the nurse, you would call for help so that we could have several people helping stimulate this baby and getting them to cry and oxygenate. Here's another baby. This baby, if we look at activity, the baby has flexed arms and legs. Not sure if this baby's really moving around a lot yet. So let's give this baby a 1 for activity. The baby's pulse is probably over 100 based on the fact that the baby is responding at least a little bit to stimulation. The face is starting to pinken. The trunk's not pink yet. So let's say that the pulse is 2. I think that this baby's heart rate's probably over 100. But we would listen. or palpate the umbilical cord. For Grimace, we have that facial grimace, okay? The baby's not really doing a lot yet, so we probably will give 1 point for Grimace here. We have the facial response, so that part is good, but this baby probably needs a little bit more time and stimulation to get that prompt response. For appearance, the trunk of the baby is not pink yet. So we can see that it's still discolored. And so for appearance, the baby is not going to get any points. And then for respirations or respiratory effort, our baby's not crying. They're probably having some slow or irregular breathing. And so 1 point. And so when we add these together, this APGAR score is a 5. This baby is a perfect baby to stay right there skin to skin with mom and have some stimulation to try and get them to cry, try to get them to breathe better. The muscle tone will improve, the color will improve, everything's going to improve as soon as that baby starts to cry. So I would just rub and stimulate the baby, maybe massage their feet. They don't like that. And this baby will start crying and everything else will get better. So this baby could stay skin to skin as long as we're seeing a continued improvement. And so we will stimulate the baby and reassess in 5 minutes. So to review, APGAR score is assessment that we do on a newborn to determine well-being. Every baby is assessed at 1 minute and at 5 minutes of life. If the score is less than 7 at 5 minutes, continue to reassess every 5 minutes for up to 20 minutes. We're assessing activity, pulse, grimace, appearance, and respiration. Thanks for watching. Be sure to subscribe, like, and share for new videos every week about everything OB. See you soon.